So in this presentation, it's on SGLT2 inhibitors, known as sodium glucose cotransporter inhibitor 2. And what it is a prescription is for, it is a insulin-independent glucose-lowering agent. And it's basically a very popular prescription for those individuals that are here in the U.S., for example, on type 2 diabetics. But for example, what is interesting is that here in the U.S., type 1 diabetics, it's a little bit hesitant on to give the prescription because of the risk of ketoacidosis. And basically what ketoacidosis means is when our blood is very, very acidic, and it can lead to very life-threatening consequences. And so what we have here is that our goal was to figure out on the use of SGLT2 inhibitors on type 1 diabetics, and to see the reason why they have discontinued the SGLT2 inhibitor. So what we did is, on our methods, we did a retrospective or observational cohort. And so what we got was, overall, we had 5,724 patients that has type 1 diabetes. And then we filtered those out, and we have around 212 patients that have taken SGLT2 inhibitors in their lifetime. And as we further break down, we've seen that 96 are still continuing to this day, and 116 of those have stopped. And in what we did there is that we break down a time range of more than 6 months that they have stopped, or less than 6 months that they discontinued. So basically, it's very important to understand the use of SGLT2 inhibitors and their benefits and their risks. And so what's very important is to know the demographic and the clinical factors that are including with SGLT2 inhibitors. And as, for example, it shows many benefactories, such as lowering HbA1c, it lowers creatine, and it provides cardiorenal protection for those individuals that have maybe any heart problems and kidney problems as well too. And what we can see here as well, that if it shows benefactories to lower hypertension, and it lowers heart failure as well too. As we see here, that when people are continuing the SGLT2 inhibitor, we have 0 people that have had any heart attacks, and people who have at least taken more than 6 months, there's 0. And we see here that people who are taking less, they have a bit of a percentage of having a heart attack. So what I find interesting in our findings is that our assumption is discontinuing SGLT2 inhibitors on type 1 individuals is that it's basically the assumption of the risk of ketoacidosis. But as we see here on our findings is that the most reason on discontinuing is the administration issues, where people just can't cover it, their insurance can't cover it as well, which is unfortunate because many people can have beneficial from these prescriptions, but they just can't afford it, which is very unfortunate. So that's basically what I found very surprising and interesting, because our number one assumption on this medication is for ketoacidosis, but we see here that there is a high rise on administration issues.